Welcome into CommonWell TV 2022 here from our Orlando studios, where we're introducing you to some of our CommonWell Health Alliance members. It's time now to hear from the Chief Solutions Officer of WellSky, and that's Amy Shellhart. And Amy, let's start with this. CommonWell has been using FHIR since its inception, but soon CommonWell will be able to move that discrete data exchange across the network. So what does this mean for patients and providers?
Well, thanks, Scott, first of all, for having me. And that's a great question. What does discrete data exchange with FHIR mean from a CommonWell perspective? And I will say, as an industry, we've made relatively little progress over the past 30 years. I think HL7 was launched my senior year of high school. And for me, it's very exciting and encouraging to see the momentum building, especially with the great advancements that CommonWell is leading with FHIR. CommonWell often uses the tagline, interop done right, and WellSky can really relate to that statement. We believe it is our responsibility to enable interoperability across the continuum. And so by enabling discrete data exchange with FHIR, patients and providers will be able to easily access the exact information that they need. And so today, when a query is made to CommonWell for a patient, there may be hundreds of documents available. And while frankly that fact in of itself reflects the great strides that CommonWell has made growing the network, it can present a challenge for the consumers of that information to narrow down quickly to what they're looking for. So let's say, for example, that a physician wants to know if a person has been using insulin or they've ever been prescribed insulin. Ideally, you would be able to search for that. Right now, when we search by patient, and we might pull back lots of documents like CCBAs, and they could still see that. They'd have to scroll to the medication section, and find that information, but they would kind of be doing that a document at a time and really digging for the information, which again is still strides compared to what we had before. But, with discrete data exchange, it now, what I envision one day as we continue to work together is the ability to search for a specific FHIR resource, like a medication resource, and actually be able to limit the amount of information that a provider is having to process and get the results back to specifically solve that ask that they're putting out there. And I think the other thing is, FHIR also offers, it improves interoperability because it allows for data information exchange with a wide array of system and devices. So to your question about what does it mean for the patient, it's not just about the EMRs being able to exchange data, but also patients who have mobile apps or medical devices and wearables who really want to use their own information to perform better self-care. It now allows them to capture that discrete information that they can use to make decisions about what they do every day to improve their health.
And Amy, you just touched upon it, but quality data, it's so important for the entire alliance. And so why is data quality so critical, not just to improve data exchange, but at the same time also improve equity within the healthcare sphere?
Data quality and equity, that is a really great question. And even the best provider is restricted to rendering treatment decisions based on the information they have available to them, right? And so the more complete picture that a provider has of a patient's clinical, social, environmental, right, the socioeconomic status, the easier they can create a plan of care that addresses all the gaps in a patient's need. And so we know that clinical aspects of a patient's care are extremely important, but they're only a portion of what affects well-being and outcomes. I think that's 20% or something for the studies. So for example, WellSky's recent acquisition of Healthify, which is an organization focused on referral management solutions for social determinants of health. That information also needs to be able to make it to the networks. We want physicians order Meals on Wheels or medical transportation, just like they would order oxygen or like they would order an infusion pump or whatever. We want those pieces of information to also make it available. Those are the things that help promote the equity and understanding what are the needs of a person beyond just their clinical care, but all those things that help them to be successful. And that network, having the CommonWell network to share that information with, makes sure that things are more equitable and more holistic for the care of the individual.
Amy, why has the relationship between WellSky and CommonWell been so valuable in your estimation?
Yeah, well, it's extremely valuable. I mean, thanks for asking that question. I think that part of why it is so valuable is the synergies we achieve together. Ultimately, WellSky is representing over 110,000 post-acute care providers, 5 million caregivers, over 500 community and social support organizations. And the amount of information by us participating in the services that are provided by CommonWell, the amount of information we can bring to the network to grow the network is really exponential. We recognize, because of the breadth and depth of our portfolio, that we are uniquely positioned to bring a significant amount of information to the CommonWell network. A great example of that is our partnership with Option Care Health, bringing visibility to home infusion, what's going on with the home infusion records of patients, and doing that in over 50 states just with that one client. And we think about how we're going to multiply that times over and over as we continue to roll out through SNF and home health and rehab and so forth. So while it has become fairly easy and commonplace to gain access to patient information coming out of hospitals, we feel like by representing the post-acute care world, we're starting to open up that aperture and really change the landscape of what it means for interoperability. We think we're uniquely positioned to change things for the better, and we're definitely committed to doing so.
She's Amy Shellhart of WellSky, and for more information on their organization and how your organization can become a part of the CommonWell Health Alliance, we invite you to log on to CommonWellAlliance.org.